Well, good afternoon. Today, we're taking another important step on the road to economic recovery. We're introducing legislation to get Ontario back on track and back to work. Today's legislation is a first step. The COVID-19 Economic Recovery Act is the beginning of our Made in Ontario plan for growth, renewal, and recovery. Because Ontario Made means something more these days. It means supporting local small businesses, workers, and communities as Ontario gets back to business. It means putting people to work, building better roads, bridges, highways, and transit, and building it faster. It means ramping up Ontario's manufacturing machine to build the best PPE and medical supplies right here in Ontario, so we never again have to rely on another country for these critical supplies. And it means getting the government out of the way so small businesses can adapt and grow. I want to thank Minister Clark for bringing this legislation forward. It lays the foundation for a strong recovery for Ontario, a foundation for jobs and development that will strengthen our communities and create opportunities for people. We're already working to get shovels in the ground faster on vital infrastructure projects across the province. Projects that will create jobs, build more highways, transit, and housing for people. And we want to build these projects hand in hand with our local communities. And today, we're bringing in further measures to give municipalities new tools and supports. As Premier, I will always stand with our municipalities. My government is at the table. We are in active negotiations with the federal government to get municipalities the support they need. We need the Prime Minister's help. No province, no community can do this alone. We need a fair deal for our municipal partners. My friends, we have a long road ahead of us, but our province has everything we need to succeed. We will bring prosperity back to this province, the likes of which this province has never seen before, and we will come back with vengeance, stronger, more prosperous, and more united than ever before. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Clark.
Thank you, Premier. Municipalities have risen to the challenge to keep people safe while continuing to deliver the services everyone depends. And as we move forward, helping thousands of people get back to work. Municipalities will be a key partner in our economic recovery, and that's why the legislation I tabled today will include regulatory and policy changes to support our municipal and community partners. Throughout the pandemic, we have worked with our municipal partners to make sure they have the support they need and the flexibility to use it. We provided them with the ability to hold meetings electronically during the emergency, and we think that makes good sense even after COVID-19 is over. To support physical distancing or in times of illness, we are giving municipalities the ability to choose to allow their members to vote by proxy. We also recognize that economic growth and job creation will be a priority after COVID-19. So we're proposing changes that would help avoid delays on critical development projects outside of the Greenbelt, and harmonizing Ontario's building code with national codes while continuing to protect public safety. I've spoken many times about Ontario's housing crisis, which has been further impacted by COVID-19. One of the ways to boost housing is to make the upfront cost of building and what municipalities can expect to see by way of revenues clearer. So we're proposing to make that more transparent. Our government will continue to be a champion for our communities with the federal government so they can face pressing financial challenges. We know the need is urgent, and we will continue to work with them and push for a joint funding program given the national scope of the impact so that every community can chart a path to strong economic recovery. Ontario's municipalities are the backbone of our great province, and as we continue to reopen the province and recover from COVID-19, we must continue to remove the barriers to a brighter future. Thank you, and now I'll pass the mic over to Minister Sarkaria.
Good afternoon, and thank you very much, Minister Clark and Premier Ford. As Associate Minister of Small Business and Red Tape Reduction, I've been meeting with small businesses from every sector and corner of Ontario. And over the course of more than 80 roundtables and more than 1,250 submissions received through the Tackling the Barriers portal announced in April, we've identified areas that can help businesses address the challenges they face today and jumpstart Ontario's recovery in the process. Today, I am pleased to share that our government is delivering on our commitment to build an Ontario that works better for people and smarter for business. I am proud to announce several changes in this bill that will modernize regulations, digitize government processes, and further tackle the barriers that COVID-19 has created. Underpinning these changes as to how Ontario does business is our commitment to 7 regulatory modernization principles. To apply a small business lens and consider their needs. To use industry standards or international best practices. To go digital. To strengthen risk-based inspections. To create a tell us once culture. To focus on outcomes-based rules in order to drive better compliance, and to focus on the user. Abiding by these principles will ensure Ontario regulates in a smarter way, and it will help restore our competitive advantage as we start down the path to economic recovery. I am proud that across government we are working to establish clear and effective rules that require all health, safety, and environmental protections be maintained or enhanced. And I'm proud to support the COVID-19 Economic Recovery Act, which continues in our mission of modernizing Ontario by, among other initiatives, completing the next step in updating Ontario's nearly 50-year-old environmental assessment program by aligning our process closer to those of the federal government and other provinces. As part of the Act, we are also helping farmers and municipalities by streamlining the Drainage Act. And we're making it easier and faster to build provincial highways, major infrastructure projects, and affordable housing. Together, by modernizing or eliminating costly and outdated regulations, we'll be able to concentrate on regulations that keep workers, customers, and the public safe and healthy, and create the conditions that will jumpstart our economic recovery and get Ontario back on track. Thank you.
Okay, we'll go to the phone line for questions. First question.
First question comes from Colin DeMello from CTV News. Please go ahead.
Hi there. Good afternoon, Premier. You said today that you stand with municipalities. Municipalities seem to be making the exact same argument that you are making here at the federal government. They're saying that the province really isn't stepping up with any financial assistance. Premier, can you put a hard figure on how much money the province will be setting aside for municipalities? And will there be any qualifiers to receive the funding, or is the government willing to just transfer funds and let them decide how to spend it themselves?
Well, first of all, we're in negotiations with the federal government. We're going to put money forward to the municipalities. And Colin, I'll be very frank. When we're on the call with the premiers, I'm leading the charge for municipalities, pushing them like crazy, the federal government, to come up with a fair deal. And right now we're in negotiations, and I'm not happy with where we're going right at this point, but hopefully we'll get to that point.
Follow up.
Thank you, Premier. So what does that mean? If you're not happy with the situation, does that mean that the province is willing to backstop the need that the municipalities have yourself? I mean, what does that mean that you're not happy? I mean, today the federal government announced a $343 billion deficit. The debt is at $1 trillion. Do they have any more money to actually spend? The government in the province of Ontario has some money to spend here. Why not just bankroll it yourself?
Well, they put a proposal to spend the $14 billion right across the province. Every single premier has said over and over and over again, we want the flexibility because no one knows their provinces and jurisdictions better than the provinces themselves, and the per capita. We're approximately 38% of the population, and I want to make sure we get 38% of the money. We're negotiating. We aren't there yet, but I'm not going to walk away and just make a deal, a bad deal, put it that way. We have the money. We need the federal government to come up and put the money up, and I'm not even asking them for more than $14 billion, even though I don't think it's enough, but I'm not asking them for any more. We're all asking the same thing. Give us the flexibility and give us per capita. And we have a deal. It's done. But we have a tremendous amount of money sitting there waiting for the municipalities. But I need the municipalities to talk to their local MPs, talk to the federal government. I know a lot of the large urban mayors talk to the federal government. So I'm pushing for you. I'm pushing for the municipalities. I'm not going to walk away with a bad deal.
Next question.
Next question comes from Tina Yazdani from City News. Please go ahead.
Hi, Premier. I just
Hi.
want to follow up on Colin's questions.
Yep.
I know you say that you're in active negotiations. Can you just provide more details about what exactly is the sticking point? I mean, some mayors are saying that this is a staring contest between the province and the federal government. They're blaming you as much as they are blaming the federal government for what's holding this money. And what is a realistic timeline for when they can actually get some of this?
Well, first of all, there isn't a day that goes by I don't talk to one mayor and numerous mayors. And I think I talked to 4 or 5 of them yesterday. I'm negotiating on their behalf, and I need them to be on the team to negotiate with me. I'm fighting for them. And if I walked away, the municipalities wouldn't be too happy with the amount that the federal government's offering right now. It's as simple as that. We aren't getting the per capita that we expect. I'm not going to get into the weeds. I'm not going to get into the details. All I can tell you, I'm fighting for the municipalities. And it's clear as day. I know media, you can talk to any premier. They'll tell you the exact same thing. No matter if it's Scott Moe, the chair, or Jason Kenney, or Francois Legault. Talk to any of them and they'll say the same thing. We want flexibility and we want per capita. And it's not going down that road right now. I just don't believe, I believe when we give money to municipalities, they should have the flexibility. As simple as that. They know their municipalities better than we do.
Follow up.
Okay, my next question is for my colleague Faiza Amin. Toronto now has concrete data proving that COVID-19 is impacting the most vulnerable and racialized communities at higher rates. What policy changes is the province making now in response to this data? At what point can we see concrete steps on the ground to address this?
I'll pass that over to the Minister of Health.
Thank you very much for the question. As you know, we are now collecting that data, that we have made a regulation change that has been requested by many community groups, and we want to understand the effect of COVID-19 on different populations. That's something that's also very important to Dr. Jane Philpott, who's working on the Big Health Data Platform. That is going to be entirely useful information, both in terms of short-term decisions that we will need to make on health, as well as longer-term decisions. So we've just started to collect that data now, but it is going to give us a lot of information on the changes that we should be making in the future. So I look forward to receipt of that data, and I know Dr. Philpott is looking at it the same way from the Big Health Data Platform.
Next question.
Next question comes from Randy Rath from Sage TV. Please go ahead.
Hi, Randy.
Hi, Premier. We're doing a story today about people who want to go and visit their loved ones in congregate settings, but they need a negative COVID test to do so. And we've talked to one woman who had a COVID test 13 days ago and has yet to see her results. Why is it taking so long for people to get COVID test results?
Well, the results, I'll pass it over to the Minister, but last time I checked, it's no more than 2 days, and I think it's 90, I better not quote the exact number, I think it's a very high 90%, but I'll pass it over to the Minister of Health.
Well, right now we're at about 96% for COVID tests to be returned within 24 hours, the rest within 48 hours. A length of days that you've suggested is not acceptable, certainly something that we would want to know about and follow up with. So I'm happy to speak with you further about that to understand what's happening and see what we need to do to get things moving faster there. But for most of Ontario right now, I can tell you we are at about 96% within 24 hours.
Follow up.
Okay, and also what steps should people take if they find themselves in that situation? I mean, not everyone can call the minister. Who should they talk to?
Well, first of all, just to back up, if Ivana will reach out to you and get that person's phone number, because that's unacceptable, something's wrong. A couple of cases that I've found when I talk to people and they said they haven't received anything, I ask them to go online on their emails, and they say, oh, I didn't realize they emailed it over. The vast majority of the results are given by email. I'm not saying that's the case with the person you talk to, but they should follow up with the ministry, and I'll pass it back to the Minister of Health. Maybe there's a number they can follow up on.
Well, certainly, as the Premier has said, that the results may be available online to this person. Perhaps they're just not aware of that. But I would suggest that their first step should be to contact their local public health unit, and they can just check online at the Ministry of Health to find out what the telephone number is for their local public health unit, and they should be able to look into that very quickly for them. If that doesn't work out, certainly they're welcome to contact me at the Ministry of Health, and we will follow up to understand what's happening.
Next question.
Next question comes from Christina Tanalia from CP24. Please go ahead.
Hi, Christina.
Hi, Premier. I wanted to point out I actually reached out to the Ministry of Health about Randy's question about this woman, and I didn't receive a reply from the ministry, so I will follow up as well. But I appreciate you addressing the matter, as this woman has been trying to see her child in a group home and requires a test, a negative test. Now I'm trying to recall what I wanted to ask you about. I'm going to ask you about long-term care. So in the act that the amendments to the act that you put forward today, there is nothing, there's no changes to the Long-Term Care Homes Act. And Premier, your frustration and upset was clear yesterday in regard to no air conditioning or air conditioning not being available or mandatory in Ontario's long-term care homes. So I know there's a review underway, but this seems like a missed opportunity to make immediate changes to the Long-Term Care Homes Act, even something as simple as a timeline for mandatory air conditioning in homes. Why were there not changes to the Long-Term Care Homes Act included in this bill?
Okay, so first of all, I want to start off with thanking Lisa Sheng from CBC. You know, we should name this bill after. I was in immediate contact with the Minister of Long-Term Care. She's pulled out the legislation. We're going to move forward with this, and things. It just doesn't happen within 3-4 hours of last night and put it on the bill. It's impossible. We're going to move forward with this. We're going to move forward rapidly. We're going to make sure that the common areas right now within the bill, it says common areas are air conditioned, but just imagine someone sitting up in a third-story room. I know how this works. Believe me, I've been in these long-term care homes. And sometimes they don't have an opportunity to bring these patients, especially now, into these common areas. And I can't imagine sitting there in 27, 28 degrees of heat in a room, and it's just unacceptable. We'll support this. We're looking into the funds to support this as well. But we're bringing this forward immediately, and the minister is acting immediately. We had a good conversation last night. I reviewed the legislation. And the other area right now with COVID happening, they were concerned about the flow, be it fans, so they didn't have any fans. I just can't imagine what they're going through. But thanks to Lisa, and thanks to all the media, by the way. When you ask me these questions, you get a response, and I want to thank you. You're part of the team. You're part of Ontario, and when you bring these things to my attention, the government doesn't know everything. I'll tell you that. The best ideas I get are from phone calls I get from people, and that's what goes for our ministers too. They talk to someone that has an issue or has a problem. We look into it and we act on it. So we're going to act on Lisa's idea yesterday, and any other media that brings it to our attention. I can assure each and every one of you, part of the media, when I walk out of this room, the questions you ask me, I don't forget about them. I address every single one, no matter what ministry it is, and we act on it. And I appreciate what the media does every single day.
Okay, follow up.
Thank you, Premier. Much appreciated.
Thank you.
I know the first few questions you were asked are about the funding that cities like Toronto are waiting for. I spoke to Mayor John Tory about it today. You know, at first he acknowledged time's running out, but now he says time's up. City staff are preparing a report for the next meeting of council that will outline service cuts that will be coming to the City of Toronto in the absence of any help coming from the other levels of government. I know you said you're working on negotiations very seriously and you're not happy with the progress, but I'm wondering, can you give us a bit of a timeline here before, it's, as the mayor says, it's time's up and there will be service cuts in the city of Toronto?
Well, I've talked to Mayor Tory almost every single day. I talked to him yesterday, day before. I talked to the large urban mayors too, along with some small town mayors. I'm thinking on the top of my head, I talked to the mayor of Burlington, I talked to the mayor of Markham, talked to the mayor of Mississauga, talked to the mayor of Brampton. So I'm in full communication with these mayors, and I told them straight out, you want me to cut a deal and you're going to be short actually a tremendous amount of money, over $1 billion, $1.5 billion, $2 billion, I'll cut the deal, but you're going to get less money. They understand. I don't rush a bad deal. And there's not a second in my mind that the federal government isn't calling large urban mayors trying to push this forward. So, to all the mayors out there, I'm fighting for you. I'm not fighting against you, I'm fighting for you. You want to cut a deal and you get shortchanged? Well, I'm not going to shortchange maybe the large urban mayors, which I don't believe they want. And I'm not going to shortchange any of the mayors. Because keep in mind, Toronto is only 18% of the overall population. I got to protect all the other regions in Ontario. And we're working hard, and we're working every single day with Mayor Tory. I hear him loud and clear, and he hears me loud and clear too. Believe me, I'm not cutting a bad deal. Simple as that. They need to come to the table, they need to give us the flexibility, and they need us to give us our fair share. 38%, we got a deal. Done.
Next question.
Next question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon. Good afternoon, Premier. I wanted to ask you about the Omnibus bill that's been introduced today by your government. You've dubbed it the COVID recovery bill, but there are a lot of elements in this legislation. It touches on 20 pieces of existing legislation, and in particular, it makes changes to the Education Act in the schools. It changes the way justices of the peace are appointed. I'm wondering what that has to do with COVID recovery. And doesn't this then lend itself to criticisms from, the opposition or critics of your government that this bill goes beyond the capacity of COVID recovery?
Well, schools are part of COVID recovery. Again, the justice system, the backlog is staggering as part of COVID recovery. Everything's related to COVID recovery. Making sure that we move forward is about COVID recovery. But let me pass it over to Minister Clark here.
Thanks, Premier, and thanks, Sean, for the question. The Premier is absolutely correct. We have a very limited legislative calendar, and we want to ensure that we have the biggest impact for Ontarians. And he's right. The justice system is part of COVID-19 recovery. The education system is as well. And because the bill is under my carriage in the House, municipalities, we've said this right from day one, that municipalities will be leading the recovery in communities right across this province. So we have a comprehensive bundle of legislative amendments that deal with a number of sectors that will help get our communities back on track.
Follow up.
Premier, on another subject, I wanted to ask for your response to the Auditor General's report this morning that she says your government exaggerated the costs to house and care for irregular border crossers back in 2018. She found that the costs were not $200 million, as your government had said at the time, but were probably closer to around 80. And I'm wondering how this happens. Did your government intentionally mislead people on the costs to the Ontario taxpayer?
Absolutely not. We rely on the Ontario Public Service to give us the numbers. They're the numbers they gave us. But thank you, Auditor General, for pointing out that the federal government has cost this province, cost you, the taxpayers, $80 million for illegal immigration to come across our borders, and they've only paid us $15 million. Municipalities, they paid Ottawa, Peel, and Toronto. So, where's the money? We need the money. It's simple as that. So I'm glad the Auditor General pointed out there's $80 million of taxpayers' money for illegal immigration. Well, there's endless families that came over here legally, working their backs off, wanting their mother, brother, sister to come over. They've been standing in line for years, and other people jumped the line. And and they still haven't paid us. 15 million versus 80. And I'm glad the Auditor General, matter of fact, I'd like her to jump into it deeper, because I truly believe, and I think she put in her report too, that's not 100% accurate, but we need to dig into this. And every single day is costing us more and more and more. So I appreciate it, but I'd like the Auditor General in another 6 months do another report to see what it's cost us since the last report. It's costing us millions every single day. So I thank and I'm grateful for the Auditor General mentioning that.
Last question.
Last question comes from Michael Crawley from CBC News. Please go ahead.
Hi, Mike.
Hi, Premier. On the Omnibus bill, specifically, there's changes to how the environmental assessment laws, in particular, it seems to give Cabinet power over deciding whether a project actually has to undergo an environmental assessment. Can you explain what that has to do with COVID economic recovery?
Absolutely. Before I pass it over to the Minister here, this is about getting the economy up and going. It's unacceptable, Mike, that we lost a $500 million deal down to Ohio because the company was concerned it would take up to 6 years to do an EA. Our number one priority is to protect the environment. Our number one priority is never to go into the green belt, and I've kept that promise. We'll keep that promise as long as I'm here. We will not touch the green belt. Our promise is to make sure we have clean lakes, clean rivers, and clean air. It's absolutely critical. But we can't wait 6 years for job recovery and not give companies certainty where they're going to invest, and they just leave. They go down to Ohio or whatever other state. We're losing jobs, and we aren't going to make sure that we aren't going to dodge EAs or anything. We're going to make sure we strengthen them, but we're going to do them quicker and smarter. Do you know that the environmental assessments hasn't changed in 50 years? 50 years. This goes back to the federal government. But I'm going to pass it over to the Minister.
Thank you, Premier, and thanks, Mike, for that very important question. As the Premier has said, the Environmental Assessment Act is over 50 years old. We indicated in our Made in Ontario Environment Plan that we would be looking at the Act and ensuring that it met today's needs in terms of development opportunities. As the Premier has said, we are taking the lens of looking at major projects and their impact to the environment versus smaller projects that might have little or no impact. And we have a number of examples. The call I was on the other day with the Mayor of Caledon, he used an example of replacement of a box culvert in his area, where it ended up doubling the cost of just replacing the culvert. We have to deal with obviously big projects, but should the environmental assessment for a landfill site be the same as replacing a box culvert in a rural community? So those are the type of lens that we'll be looking at in terms of maximizing those big major projects and ensuring, as the Premier has said, that we protect the environment and we use the assessment process to look at those projects that have the biggest impact in our communities.
Follow up.
On another topic, Premier, either for you or also the Health Minister, if you'd like to comment, the rules around visitors coming into long-term care homes. There's a lot of top geriatricians who are saying that they're too restrictive, in particular for family members who are essential caregivers. Is the province considering anything in the way of changes so that family caregivers could have more opportunity to be able to go in and visit family members in long-term care homes as opposed to just casual visitors?
Well, I'm going to pass this to the Minister of Health, but I am so concerned. The more people we bring in there, the chances go up. And then, God forbid, something breaks out, Mike, you're going to be asking me different questions, I can assure you that. So I will do whatever it takes to make sure the number one, the people in long-term care are protected. But number two, we have to be flexible in making sure the loved ones get in there to see their elderly parents or whoever might be in there. And by the way, Mike, say congratulations to Lisa. I think she'll be the first person in the media. We should be naming that bill, that legislation, after her for helping us out on the air conditioning. So I think the world of her for coming up with that question, but I'll pass it over to the Minister.
While we know that there are many family members that want to visit their loved ones in long-term care and do a lot of essential duties and help them in many ways, we are still very concerned about the transmission of COVID-19 among these very, very vulnerable populations. And we saw what happened the last time when we had workers going in, when we had family members going in. We didn't have these types of constraints, and COVID just spread throughout these homes. We've got to still be very, very careful. We're not through this yet. We need to make sure that we get the community transmission completely under control. We want people to be able to have visitors. They still will be able to visit. Visiting outside, visiting inside is an entirely different matter. But as we're taking a slow and gradual approach to reopening the economy, we have to do the same thing with these very, very vulnerable populations living in long-term care homes, retirement homes, and other areas of congregate living, because we have to keep them safe.
Thank you.
That's great. Thanks, everyone. Thank you.